And while I already shared with you the news that we do not have a quorum, I also am going to now make you aware of two changes in the meeting agenda. And these are two changes that we did not have this information in time to go into the regular agenda. Therefore, we are allowed to put them on the agenda. Go down, if you will, to item number 11 under the director's report, where we already have an A and a B. Add a letter C and just put the word opioid there. Under item D, add a D and put the word masks. Those are the two changes in the agenda.
We need to make a motion to amend the agenda to that effect, or
We can't
was
make
that
any,
sufficient? Oh, we can't make.
we can't make any motions.
Okay.
It's kind of like having a meeting with your hands tied behind you.
Okay.
All right, but we can stand and do a pledge allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. You may be seated. And we have some significant introductions that need to be made today, and I'm going to call upon our director, Don. You have the floor for some introductions.
Thank you, Mr. Chairman. Two introductions to our board today. First of all, we have Danielle Scott, is our new management assistant. You see her predecessor sitting behind her. She's here for another reason, but Jill has taken on some other responsibilities where her heart really lies here within the health district, and we're very pleased that Danielle is her replacement. So she will be, other than myself, the board source for communication of all things relating to the Board of Health. So I want to welcome Danielle here with us. And also, many of you know Eric Kettner. Eric has been involved in our environmental health services for many years. With Joe Rigello's resignation, we hired Eric Kettner to replace him as our environmental health services division administrator. And Eric, we welcome you and grateful for your expertise that you bring to this position. And with that, I am going to interject what is called personal privilege and turn some time over to Kim Young that has something she would like to present to our chairman, Marlo Thompson. And before Kim does that, I want to just say, I had nothing to do with this. This was an effort by our staff. So Kim, I'll turn that over to you.
Thank you. Okay, well, this is okay. So today, thank you, good to hear this work. So today, we, Panhandle Health District, would like to honor an individual, and I think we know who that is, but who has supported us, shown us gratitude, and appreciated each and every one of us. He takes the time each year around the holidays to visit every employee at every PhD office. And he thanks them for their service, and he also shows up to present all the longevity awards year after year. So today, Mr. Chairman, we would like to show our gratitude, our thanks, and our appreciation for you and your support for us here at PhD. And so on behalf of Panhandle Health District, we would like to show our appreciation with a small token of our appreciation right over here. So we hope you accept this. And it's a lovely photo. Can I bring it around?
Please.
It's a lovely photos, collage of you with your work here at Panhandle Health District. And everyone has signed, so Panhandle Health District employees have signed to just thank you very much for your support and service for everything you've done.
Wow.
We appreciate you.
Thank you. My, oh my.
Would you like me to leave this behind you, or I can put it right up there?
Well, let's put it back there, but is it okay if I take it home?
Absolutely, this is yours. We expect this is going to go in your living room.
I just suspect that they will. Yes.
So I will put it
My
right over there.
goodness. Well, thank you.
You are welcome.
Thank you.
Thank you.
Well, now you expect me to go ahead and lead this meeting. Who, do I dare ask, who made that lovely frame? Who has that talent?
I don't know if anyone actually made it, but.
Well,
They found it at the dollar store,
Good for you.
which is now $1.25 store.
I do know it was made in America.
Oh, well, okay. Do you do things like that, Michelle? You're a woodworker, aren't you?
Very beginner. Just a very beginner.
Well, oh my. Thank you for that recognition. We're just talking with Michelle and with Dr. Jameson, and there are two people here, employees who have been employed by Panhandle Health District longer than I have been a board member. And one is, of course, our dear Michelle. And she came on board as an employee about 1 month before I came on the board as a board member. And the other person? Okay, yes. All right. Well, I won't say much because it's better if I don't try to talk too much. But I love this organization because I love the people here. This organization wouldn't be worth a hill of beans if it weren't for the people we have working here. And it's a wonderful place to be a part of. We do have time. Public comment. Is there anyone here today wishing to make a public comment? All right. If not, we will move on. And here again, you have the consent agenda before you. And that is, the action on this will be postponed to our April meeting. But we could still take any comment if you wish to speak on any of the issues here. The minutes of January 27 and the division reports. I appreciate the division reports. I like to read what's going on. In fact, I was just mentioning to Dawn, I read in the division report about a gentleman by the name of, what was the name I just mentioned to you? That's the problem with my age. Well, I just gave it to you. What's the matter with you?
Is that the one right there?
Yes,
Ted?
Ted. I read some report that Ted wrote, and I think is Ted someone you knew, Andy?
No, Ted came on after I left. He replaced Mallory.
Okay. Well, anyhow, Don knows that I want to hear it from at least one person from someplace around the district in every meeting, because every person has a story to tell that the board needs to hear, and that helps us keep in touch with our employees. All right. Well, you have the contracts. You saw them in your packet. We just won't be able to take any action on this until at a later date. And then the policies. I hope you've had a chance to read through all of these policies. This represents a lot of work. Some of the policies are completely new. A lot of them are policies that we've already had, maybe just a few changes. I did ask Dawn to comment just a moment in case you have any questions on the difference between how it works now with at-will employees and the due process and how that is going to play out. I think it's important that everyone, and I'm sure Michelle deals with this all the time. Maybe Michelle should be giving this report. I don't know. But Don, talk to us just a little bit. And if you have any questions, don't hesitate to ask him about the at-will and due process.
Well, thank you, Mr. Chairman. I appreciate this opportunity, and I do hope that Michelle does chime in on something I might miss. But there has been a fundamental change in our personnel system as it relates to House Bill 316 and the ability really of the health districts to govern everything that happens as far as personnel. We are no longer have oversight by the state of Idaho. In fact, on the governor's desk as we speak is a House bill that gives the district director full authority to create their own personnel system. That we're no longer have oversight by the state of Idaho in any way, shape, or form. What that led to is, as I mentioned, one significant change, and that is that all of our employees now are at-will employees. And that's always been the case in several of the executive staff members, that we were at-will employees, meaning when I was serving as Health Services Division Administrator, anytime our previous director, Laura Whalen, could have walked in and said, "Today's your last day." Now with this, what's happened now is everyone essentially is an at-will employee within the health district. Now that will be concerning to some because you have to ask yourself, what really have employees lost without the state being involved? What they have lost is due process within the state of Idaho. So if you look at our personnel manual, you will see that there is a process that goes through as we're dealing with an employee that we're challenged with. Verbal warnings, written warnings, a performance improvement plan, a notice of contemplative action. All of these steps before we make that very difficult decision of terminating an employee, and those are still in place. What's different, that if we were to go through all that process today and eventually terminate that employee, they could not turn to the state of Idaho and go through due process or challenge the decision of termination. And that would be on the nickel of the state of Idaho to do that. The way it is now, and because we're not part of the state, obviously we cannot use that service. But what happens now is if we go through again all of that process of verbal, written warnings, performance improvement plan, NOCA, and decide to terminate, they would need to hire their own legal counsel to fight that, to, I guess, share their own thoughts of where they should go as far as that's termination. Keeping in mind they have plenty of opportunity to do that through the process. And I believe just, with the last several years, I think Michelle has said there's maybe been 3 that have gone to due process, and none of them amounted to anything. Essentially, the state agreed with the process that we went through. So it is a substantive change as it relates to the manual, but in all reality, things will be very much the same as we manage our personnel. And this is something that Michelle and I went throughout the health district, visiting with all of our employees and let them know very clearly of this change that's happened. And again, this happened not necessarily because of our choice, but because we're clearly now no longer a state agency. And I'd be willing to take any questions about that at all.
Mr. Chairman,
Yes.
just for my information, I haven't had the opportunity to completely go through your policy. It talks about drug testing, and I guess no notice drug testing. So at any time, employees could be tested, is that correct?
Mr. Chairman, could I defer that question to Michelle to answer that, please?
Mr. Chairman, I'll just say that we have never done random drug testing
Testing?
of any kind.
Okay.
And I believe we struck that from our policy because we have not been doing that. So the only time that drug testing happens is those that have CDL licenses, and that's a requirement. And then if an employee gets injured on the job, that's one of the pieces of, for
The testing
workers' comp.
protocol, sure.
Yes, that's the only time we've done drug testing.
Okay,
Never a condition of employment, never a random drug test. So I mean,
Okay.
I'm pretty sure we struck that from our policy, because it was a policy.
Okay, any other questions?
well, I guess it's page 28, protocol 3-6E, CDL random drug testing
CDL.
protocol. So
For
that's
CDL.
only for those that have this,
Yes,
the CDL.
correct.
Okay,
That's a Department of Transportation requirement of having a CDL. And there's only 2 people in the health district that have CDLs.
I think a person has to have a CDL to drive Irv out here.
Yes.
that makes sense. Why don't you test everybody? No.
I'll be first after you.
In the counties we do, at least Bonner County.
Okay. Okay, we will continue to move on again. We have the duty today to go through the ballots to see if we have the election by the county commissioners of the 5 northern counties to place a new member on our Board of Health. As you know, the process, the nominee comes from the Bonner County Commissioners, and then this person is voted on by all 15 county commissioners of the 5 northern counties. And by common consent, it's a good thing we can do things by common consent because we can't have an actual vote. But it has been our tradition to have our secretary, administrative assistant, and the director of the environmental section count our ballots. And if there is no objection, will you allow these two to proceed? The envelopes have not been opened, and so they will be opened here in your presence, and they will tally and then give the report to me, and I will report the tally when they are finished. Is there any objection to proceeding in that way? All right. You two go right ahead as time permits, and we will go ahead with our meeting.
You can get a paper cut like that. Is that safe?
Since Eric is next on the agenda, you may want to skip item 8 and move to 9.
Oh, okay. All right, if you notice that item 8 on your agenda, and I've already mentioned that the policies, we will postpone the action until April. Item 8 involves Eric. Let's only ask him to do one thing at a time. And move on to 9. Glenn, do you have anything as a trustee, executive council report? I know what you told me, but what would you like to tell the folks here?
Mr. Chairman, the last trustee meeting was back in February, as I recall. And it was much anticipated because generally during the legislative session, we meet on a regular basis as trustees to discuss what proposed legislation might impact the health districts. And I've heard crickets since that first meeting. No other meetings have been scheduled until just this last week when I received an email saying, hey, we're going to hold our next meeting, I think it was 12 May. And there was no explanation as to why the delay in having the meeting, other than the executive council meets as required to discuss issues that may impact the health districts. And evidently, during this legislative session, I mean, there was huge change last time around. So we weren't anticipating any big changes, but part of the legislative process is that we will implement this, see how things develop, and make adjustments as necessary to the legislation. And so far, there have been no proposed amendments or adjustments to that legislation. Was it 316 that was passed last year? So at this time, we don't have another meeting scheduled until the 12th of May. And I'm assuming that that will be in preparation for the annual health district conference that normally happens the first part of June. So that's where we're at. And that's all I had to report, Mr. Chairman. Are there any questions?
What district is responsible for the,
Currently, it's District 4.
is District 4?
Elton is,
That's always scary because I know who always comes after 4. And it isn't 5.
it is 5. Yeah. Yeah.
It's 1.
So
It's 1.
we will be hosting it again.
Okay.
And they
Thank
always
you.
look forward to
Yeah.
coming up to
Yeah.
visit us.
Okay. I'm going to turn the floor over to Don right now, Christine, and let's see what he has to say, and then you're next.
I'll stand. So today we will be presenting to the board our draft, and I emphasize draft budget for FY23. As you remember the process, we present this as a draft to our board. No action is taken on it. And then Christine and I will go out and visit with all of our county commissioners to go over the budget with them, hopefully getting their support. Once again, in those visits, no action is taken. It isn't until we have our hearing in May where all of the counties will be represented in a meeting like this, where the vote will be hopefully approved at that point. But I wanted, before Christine gets into the details, the budget is significant this year. There's some changes compared to previous years, and I wanted just to go over that with you. And first of all, as a backdrop, we know about inflation. Inflation is 7.9%, and in the health district, we've experienced that like everybody else. Everything has gone up, from lawn care to gas to medical supplies. We're seeing it across the board that we are definitely being affected by inflation, with no easing that we see in the near future. But even more challenging for that has been the cost of our employees. Those costs have gone up, wages have gone up. The Idaho Department of Labor has mentioned that in Idaho, just from in 1 year, salaries were up 5.4%. And that's difficult for us to deal with that with our employees. And it's been shown in our turnover rate. If you compare the first quarter of 2020 to the first quarter of 2021, our turnover rate went from 3% to 10%. And I do exit interviews on our employees, and we're just hearing all the time, I'm leaving for better pay. We also are a bit struggling what our pay structure has been for so many years. We have been paying what's called 80% of policy. So the state has a low wage, they have a policy range, which is average, and they have a high range. We've been paying at 80% of policy, so 80% of the average salaries in our area for many years. And we just cannot continue to do that any longer if we're to keep quality employees in the health district. And that turnover of 10%, as you know, is very expensive for us to handle. Just imagine 10% of our people. And this is not including those that were hired here to deal with the COVID-19 response. That's separate, and that is reducing dramatically. So as a result of that, what you're going to see in the budget presentation are a couple of things. One, you're going to see that we're asking for a 2.5% increase from our counties. Yes, the last 2 years, we didn't ask for any increase from our counties. We're now asking for a 2.5%, which, is roughly around $37,000 total for all of our counties. The other thing you're going to hear more about is we are going to propose an increase in our septic fees. And I understand that can be a little touchy throughout our counties. But this is one area specifically where we are losing environmental health specialists fairly regularly to Spokane. They pay more in Spokane, and yet ours are certified. We come in here, they get certified, they do a great job, and then they're stolen from Spokane. And so again, an area. So we're going to present that to you as well today. And one of the reasons our budget is going up is we are proposing in our budget that we're going from 80% of policy, as I mentioned, up to 90% of policy. We're not even asking to get salaries at average. We're asking to get 90% of the average salary. And that, of course, is a significant expense here for the health district. And we have gone long and hard on other things we're doing to get this into budget for FY23, which includes not replacing several positions here within the health district. And I am so proud of our employees for the sacrifices they're willing to make to get this where we need to be to have quality employees here at the health district. So, with that as a backdrop, I'm going to turn the time over to Christine, Mr. Chairman, to go over the details of this budget. But remember that it is a draft. This is a great opportunity for you to interject and give us suggestions moving forward. So with that, Mr. Chairman, if we could turn the time over to Christine. Unless you have any questions before I sit down.
Christine, the time is yours.
As Dawn mentioned, this is a draft budget, so this is going to be a very, very high-level overview of the fiscal year 23 budget. First, we're going to look at what I did is the fiscal year 22 budget included COVID. To make it more of an apples to apples comparison, I pulled out what had been budgeted for COVID for this presentation. So we'll be looking at fiscal year 22 budget without COVID and compare that to fiscal year 23. So in total, our salaries for fiscal year 23, with everyone brought up to 90% of policy, is currently estimated at 6.6 million, a $642,000 increase, 11% change. Employee benefits, 2,900,000, a $34,000 increase. There's no change in fiscal year, the actual fiscal year 22 health insurance compared to the budgeted fiscal year 23 health insurance. The other small item that went up was the workers' comp rate. There was a slight increase, very minimal, but a slight increase in workers' comp. So total personnel, a percentage change increase of 8%, representing $677,000. Operating expenses, we anticipate that they will be approximately 2.9 million compared to prior years of 2.8, an increase of $157,000 or 6%. Capital expenditures, this year we did not budget anything for any major capital item. We did budget $50,000 for facilities maintenance if needed. At this point, it hasn't been earmarked for a specific project. And the other remaining amount of the capital expenditures would be the loan payments on this facility. So it's the normal loan payment required by the loan plus the additional principal that we have been making on the Sandpoint facility, but we're now including in Hayden to have it paid off, before the loan interest rate increases. So that's a decrease of $178,500, 29% decrease. Trustee payments, last year we had budgeted $80,000 because we had a contract that we chose not to renew. It had a component in it that the Regional Healthcare Coalition, where we would pass through money to them or be able to purchase equipment for them, and this would be the category that it fell into. We no longer have that contract, and this is always a difficult one to budget. Currently, we have budgeted $10,000, $70,000 decrease, and in percentage form, that is an 88% decrease over prior year. If we look at our revenues, last year we had anticipated that we would be taking $18,000 out of restricted funds. This year, this is just a rough estimate. We have $7,500, a decrease of $10,500. Licenses and fees, this would be our environmental fees. Last year, we had projected $2 million. This year, we're projecting $2.1 million. That's a $70,000 increase, 3%. Our fees here include the anticipated rate increases if they're approved. Health services, last year budgeted at $2.4 million. This year, $2.597 million, an increase of $197,000. That's several things. That's assuming that we're back to normal staffing in home health. We have normal foot traffic in clinical and also some Medicaid revenues that we're allowed to bill in one of our programs. Contracts and grants, we anticipate that they will increase by approximately $334,000 to $5.7 million. That's a 6% increase. We anticipate that most of the grants will remain level compared to prior years. There are several increases and additions that we're expecting. That would be an increase in the Millennium funding and some of the opioid funding that will be coming our way. This is still rather an uncertain number, especially as it relates to the opioid funding. Donations and other could include rents and interest. Well, I do have interest as another line item, but primarily rents. So what we're budgeting this year is $73,000 compared to $33,000, a 121% increase. What this $40,000 is it is due to the rents that we are receiving in the other counties. We have space rented in the St. Mary's facility to two other agencies. We have space rented, small space rented in Shoshone County, and also space rented in Sandpoint. So that represents most of this $40,000. Interest, I'll be honest, this was just a very rough estimate. I took it down to $5,000 compared to what we had budgeted in fiscal year 22 at $27,000. Really, all I did to get the interest rate for fiscal year 23, I annualized fiscal year 22. Current to date, I annualized it. So that's a decrease of $22,000. Our general aid in fiscal year 22, the counties contributed $1,237,000. Don mentioned we're requesting a 2.5% increase. That brings it to $1,268,000, and which is $30,944 here. And House Bill 316, based on fiscal year 21, that amount is $1,222,000 based on House Bill 316 and the formula. If we compare it to prior year, that was split out between 4 months to the county and 8 months to the state. Overall, it's a 5% increase in the budget. Any questions, Mr. Chairman?
Any questions, comments, Glenn?
Mr. Chairman, my question is on line 23, the donations and other. You're anticipating a $40,000 increase, and you say that is in rental
Yes,
fees?
$37,000. We have two agencies that rent small space in St. Mary's, actually hospice and Department of Labor. And we have an agency that is renting space in Sandpoint and Kellogg, Ideal Options. And in total, all four entities combined, their annual rent represents $37,000.
And that wasn't factored in last year?
Last year, it was a very, very small amount because we only had Department of Labor and hospice. And I think hospice came in later, if I remember correctly. It wasn't a full year's worth of revenue. But Ideal Options, they are new, and their rent is calculated at a different rate for fiscal year 23. This may change between now and April. We're going to review how we look at our rents for these other entities and other entities that may be interested in space.
So a follow-on question then. Are these rents leases or actual a year by year rent? Or how is the rent calculated or determined? Is it on an annual basis that you notify them the rent will be this amount in the next year? Or how do you
We did do,
manage that?
excuse me, we did do lease agreements with the two, well, they all have agreements and they all have confidentiality agreements. And the two most recent were determined based on square footage. And I may have to look towards Mr. Duffy for some input here. But they were calculated based on a formula for square footage. And this is an entity that is in the business of doing, if I remember correctly, some form of drug counseling for individuals who have had substance use disorder. And they go in, meet with these individuals. They're using one of our exam rooms. So it was more of a commercial lease determination when we designed and executed the agreement.
Okay.
Does that answer the question?
Mr. Chairman, if I may add a little bit to Christine's explanation. The ideal options, what they're doing is very much a part of our goals of dealing with opioid use disorder. This was an outside company that wanted to come in and use our offices 1 or 2 days a week in both Shoshone County and in Bonner County. But being that that was new to all of us, we did not do, and nor did they wish to have a long-term lease for that. We're kind of in that test phase of how we're moving. And so far, it's going very well without any real conflict with our clinical services. And so the next time when we come back to the table, I'm sure both parties will be willing to extend that lease longer than what it is. But it is true, as Christine mentioned, it's a true commercial lease. It's a gross lease. It's not a triple net. We factored in them covering for utilities and taxes and all of those kinds of things. And so we will be renegotiating that. But it's not a long-term solution. But so far, both parties are very happy where that's going.
Okay, so you anticipated it being an ongoing and renewal, okay.
And in fact, even potentially some expansion. They may want to go from 1 to 2 to 2 to 3 days a week, depending upon the location. And that would be additional rental income for us. But we do not want to conflict at all with our clinical services, WIC services that take place in those offices as well.
Sounds like they're providing a good service for the communities that you want to see continue. And so I was concerned that it may be pricing them out of the market, or they may have to look for somewhere else, but you're trying to keep it competitive with other rentals in the various locations.
Yes, Mr. Chairman, yes, we did look at other rental rates in the area, and we're below what those rental rates
Okay.
are. If anything, we might have the opportunity to increase the rate, particularly what's happening in commercial in both Shoshone and Bonner County.
And these commercial activities, are they using grants to fund what their services are doing?
Mr. Chairman, yes, they do have grant funding associated with the
With-
services they
okay.
provide.
Okay, that answers my questions. Thank you.
You bet.
Well, let's go to Shoshone County. If we rent, how do we rent what we already rent?
Yes, Mr. Chairman,
We
very good
sublease.
question. It is a sublease. We have communicated with the landlord that we can in fact sublease that space 1 day a week.
Well, then, does our landlord get a cut out of that lease?
No, sir.
but that could give our landlord just cause to raise their lease to us because they know we are getting some of that back from someone else.
Well, Mr. Chairman, my comment to that is they probably don't need that even to raise rates. Commercial property in Shoshone is next to nothing. And we expect when our rate is renewed, we will see an increase in our rent. Probably not so much because we're subleasing, but simply because the lack of commercial real estate in Shoshone County and inflation.
So the question that we will have to face down the pike is, will we ever want to consider our own facility again in Shoshone County?
At some point.
But we don't have to cross that bridge yet. Dr. Jameson, did you have any questions or comments on this powerful discussion here?
No, sir.
Okay, thank you.
I think I would like to add here that included in this budget, since you're discussing the Shoshone County rents, the annual rent increases are tied to the consumer price index. And this year, our rent increased by 6.89%. So for budgeting purposes, I looked at the CPI in February, and it was at 7.5%. So that's what is factored in the fiscal year 23 budget.
Mr. Chairman,
Yeah.
just a comment, I did not see this in our packet. Did we
That's
read,
correct, Mr. Chairman, that was not in your package.
not included? Trying to
we-
keep us in the dark, huh?
Well, no, not at all,
Okay.
Mr. Chairman. But this has been a Herculean effort to put this budget together. Christine gets a tremendous amount of credit, working excess hours to get this done. And to be perfectly frank with you, we finished this
Just
up
very-
on yesterday morning
Okay.
so that we could get this together to present to you today. And I'm sorry that we didn't.
And I
have the time
appreciate
to put
if we could get a copy of that to include
Yes,
with
sir.
the packet. Thank you.
Please recall that, Mr. Chairman, please recall that in your April packet, you will have the full presentation as
Okay.
we do each year of the budget presentation. You will have hard copies of that.
Thank you.
Okay, my question, how closely you division directors play into this planning?
Mr. Chairman, intimately,
Yes.
Okay,
very, very much indeed.
Yes. Same.
so then, are you getting everything you want or need, or is there a difference between you want and need?
Yes. Yes and yes. Yeah. It starts really, to answer your question, it starts with division administrators. So the preliminary budgets are kind of, we give it the first college try, and then it sits down in a review effort with Mr. Duffy and fiscal, and kind of gets finalized from there. But we are sharpening our pencils at this point. So.
Kim?
Yes, and we work with program managers as well, and we work with each of our departments to make sure that we're on par. So we look pretty deep into each program.
Okay. If we have asked for a 0% increase for the last 2 years from the counties, it's sure nice that our county commissioner members aren't here right now. Why are we so afraid to only ask for a 2.5% increase this year?
Are you asking me that question, Mr. Chairman?
I'm just asking anybody before the roof caves in.
Well, Mr. Chairman, yes, I would ask for much more than that. I will add one more step that Jenna our clinical services division administrator, as she went through the process of creating the budget, what she failed to mention is a few days ago, when we looked at the budget, we realized that we were not in balance. We realized that our expenses exceeded our revenue. So I met individually with all three of the division administrators, asking them, where can we get this in control to meet our revenue? And putting our heads together and some sacrifices, we were able to reach this budget. And I will emphasize to you, the biggest motivator of our budget this year is to get our salaries more in line with what's happening in our community. And it has been very difficult working through this budget to get to this point. Yes, we are contemplating certain programs that we may not be able to continue and those are just decisions we have to make. And yes, if we had more revenue, more of an ask from our counties, we could sustain those programs. But I also weigh that against our fiscal responsibility with these programs. We have to weigh not just the money we're putting into a program, but what is the community value of that program? Those are the two factors we look at. Our good county commissioners are facing a different year now that the state has backed out with their appropriation. And we want to be very sensitive to that as well. Finally, this year has been a hard budget in that we really don't know what's coming next year. We're assuming that the pandemic is behind us, but that's one thing we really don't know about. We have things like our opioid program that we don't know what we have our best guess of what that funding will look like. We have as we mentioned earlier, we are going to propose to you at the end of April, increasing our septic fees. We don't know if that will be approved or not. So there's several unknowns associated with it. But again, as the increase in 2.5% is it's never only, but it's $37,000. Even doubling that is nice to have, but will not make a huge difference in what we are going to do here. So we have to focus on our revenue and our expenses and make sure that we're providing the best public programs for the health of our public that we can.
Thank you, Don.
Mr. Chairman.
Glenn,
Thank you.
go ahead.
Don's comments brought another question. The fee increase for the septic systems, what percentage does that represent as far as an increase?
Well, I could answer that, Mr. Chairman, but if I could defer to Eric, I had him put together a pro forma associated with what that increase will look like, and if I may defer to his answer to that question.
Sure. Mr. Chairman, it may be challenging for me to put a percentage to it at this point, but if I could put a dollar figure to it, that would be helpful. And the fee increase that we're looking at would be would potentially generate $183,000 in additional revenue. Really, we're looking at really two fee changes. One is in the new application, raising that $100, and in the repair application, raising that $100 as well. What we're
Going from
$950 to $1,050, and what and again, we're still continuing to subsidize the repair fee because in most cases, most folks don't plan on a failed septic system. That being said, is that in the new fees, the new permit fee is associated with new development, and $100 in a $500,000 house is not going to deter anyone from building the house. So we're not seeing complaints on the front of our current fees, and certainly don't expect that with that modest change.
Understood. However, overall building costs are just skyrocketing. It's incredible. The inflation, which you're saying 7.5 measured, you compared that if they were calculating based on what they did 10 years ago, it's a 15% increase in inflation. So,
Mr. Chairman, if I may, and that is absolutely true, what you're saying. What we are seeing from the builders that we associate with is their concern is timeliness.
Yeah.
Their concern is get that permit just as quickly as I can so that I can begin. They do not want to wait.
Yeah.
And that I think there's a general feeling with them that we could accept an increase in the fee if you, health district, can continue to provide the same level of service that you always have. And I don't know, I don't believe in my time, I don't know when the last time we've raised our fees, but it's been several years as far as I'm aware.
Well, I do know that the environmental section has reduced their turnaround time immensely, which has been a great asset for the health district.
And Mr. Chairman,
Yes.
if I could add to that, this speaks to some of the theme of this meeting in regards to trying to retain staff when we're still $8 or $10 below what comparable positions are hiring in Spokane. And what we're attempting to do is provide a solid response and service to folks, because that's what moves their building project along.
Yeah.
I know it's not the same in each county, but in Kootenai County, it's 3 to 6 months to get your building permit just through the county. And so we're trying to not be the factor that's slowing folks down in our other counties that have processes that move much quicker.
Can't put a price tag on that.
and just to follow up the timeline, if for the fee increases, when will that be implemented?
Mr. Chairman, we'll present, Mr. Kettner will present that at your April 28th board meeting, and that's when the action will be taken.
Once it's approved, it'd be effective.
July 1.
No, it would be, once it's approved, it would go into effect, correct?
Mr. Chairman, I believe it has to be published.
Oh, there's 30 days?
I'm not sure.
60? Okay.
To be honest, I'm not sure.
Okay.
If you could follow up for our next meeting, just let us know what the process is, that'd be helpful.
And Mr. Chairman, one item I could add on that, we did last update these or increase these fees in the April 26th, 2016 meeting, and they did take effect on July 1 of that year. That was the last
The
time.
state fiscal year. But we're no longer. Okay, thank you.
Dr. Davis.
Mr. Chairman, two questions on that regard. One is, when you increased the fees in 2016, what was the general response from the public at that point?
Mr. Chairman, negligible.
Okay, so where did you come up with $100? Is there room for more? Because I think what I hear you saying and what we experience as community members without our Panhandle Health data is that time is always of the essence. And so if we can ensure that we're giving them a timely response, then quite frankly, it's a business and you're gonna have to pay for that. So could you go more than $100? I think you may be able to, but so I'm just curious, where did that
Mr.
come from?
Chairman, if I may address that, great question. We have to also, we don't want to be making a profit, if you will. That's something that we would be challenging for our public, and so we're trying to simply cover our costs associated with installation of septic tanks.
So with that individual service line, so you couldn't, what you're saying, what I think I'm understanding, is that you cannot take revenue from that particular project and, for instance, pay $10 an hour more to the people who are losing to Spokane, correct?
Well, Mr. Chairman, certainly, and part of the reason for the fee increase that we're asking for is the salaries were already increasing for those individuals. If we get down the road and those salary increases aren't sufficient, then potentially we'd have another raise and another fee increase to cover those.
Mr. Chairman, one thing to add, but to maybe elaborate slightly, is that the fee calculation wasn't it. What it was based on is taking a look at fully staffed, fully funded positions, what those cost projections would look like, and then we backed that into the fees and resulted in that $100.
And just a comment, Mr.
Yeah.
Chairman, that's fiscal responsibility, and that's what the county commissioners like to see. There's a window, and you shouldn't be increasing your fees to go above, that 2 to 3% above what you think it's going to cost you. The rate of inflation each year has to be reevaluated and adjusted accordingly. If you can show that, the county commissioners will say, okay.
Just a comment and then we'll go on, but there's at least one health district made up of all county commissioners. I would love to hear the discussion of this nature at a health board that are all county commissioners. Because in that case, they have to solve that problem right around this table. And I wonder how that works. All right. Go ahead, Christine.
Thank you, Mr. Chairman. Since there was so much discussion on environmental fees, I do want to again point out that this current draft budget does include the anticipation of a fee increase. So that $183,000 that Eric mentioned is already included in this 2.1 million. So the net change in the budget between fiscal year 23 and 22 is $70,000, 71,000 rounded. Mr. Chairman, if there are no other questions on the budget, fiscal year 23 budget draft, we can move on to the budget to actual for February 2022. Moving on to the cash history report. We're reporting for the 8 months ending February 28th, 2022. We ended with $4,113,000 in cash. That's a decrease of $595,000. That's a total change for the year, a decrease of $929,000. Just remember that we included the large payoff or principal payment to the Hayden facility and the payoff for Sandpoint. Before we take into consideration any reserves, the board committed reserves and program restricted funds, we have 3.72 months in reserves. Once we account for the board committed funds, program restricted funds, that leaves us with 3.03 months in reserves.
Well, good shape.
Moving on to our budget to actual. Really, the financial story does not change from what was presented in January. If we look at total fees and contracts, miscellaneous revenue, we're under budget by $1,066,000. 800 of that is in contracts, as we've discussed each meeting, as Mr. Duffy presented earlier. The decrease in grant revenue is largely related to staffing issues. If people aren't working in the contracts, you can see that our personnel budget is under budget by $501,000. If people aren't working in the contracts, we can't bill the contracts since most of them are cost reimbursement. The other thing that narrows that $800,000 gap between what we're seeing in personnel expenditures being under budget by $500,000, the other component that we need to keep in mind is actually two things. The indirect rate, the general support costs, because most contracts we can bill our indirect rate, so we're not getting reimbursed for that. So that's not being seen in our grant revenue up here. And then the other thing that's affecting this is the indirect rate that is currently being billed to the grants is much less than what it historically has been. Because in prior years, last year it was 28.02%. This year it's 22%. So it's less than what it historically has been. So we're billing the contracts less. One thing that you might notice here is our employee benefit variance is greater than our variance in salary and wages. The reason for that is when the fiscal year 22 budget was prepared, the health insurance fee that was in the Division of Financial Management's budget manual recommended budgeting at $12,930 per employee. So that's what the fiscal year 22 budget is based on. The actual rate that is being applied in fiscal year 22 is the $11,650. The budget for fiscal year 23, the budget development manual is also stating to use $11,650. So that is what has been used for fiscal year 23. But where I'm going with this is we can probably anticipate seeing this variance increase over the next few months. Total expenditures were under budget by $524,000. And again, that goes to some of the staffing issues. If they're not working the programs, they're not spending. So operating expenses would be less. Capital expenditures over budget by $565,000. Excuse me, that's related to the large principal payment. And I would like to interject at this point, when we have our April meeting, we will need to do a budget revision for fiscal year 22 to include the payoff and the large principal payment for the Hayden facility and for Sandpoint. It won't be for the total amount that we paid, but we do need to increase the budget in order to have the spending authority in STARS. Our total trustee benefit payments were under budget by $52,000. And this goes to what I was referencing when we were discussing the fiscal year 23 budget. We had budgeted $80,000 for a grant that we chose not to renew in fiscal year 22. So in total, our deficit year to date, 8 months ending, is $339,000. When we adjust for the change in our AR, accounts receivable, our decrease in cash, our decrease in accounts receivable, $590,000. We take that, apply it to the beginning cash balance. It brings us back to our ending February cash balance of $4,100,000. Any questions?
Mr. Chairman,
Yes.
if I could, Christine, line 42, the county contribution is listed as $177,417 in deficit.
That is due to a timing difference. Remember that our budget is based on 1/12 our year-to-date budget amount, so we're looking at 8/12s, and we invoice and are paid quarterly.
Sure.
So there's going to be a variance
That'll
there.
resolve with the next.
Yes, and I was alerted by one of our fiscal staff the other day that all counties are paid to date.
So
So everything's good.
that was my question mark, because they're not paying? Okay, thank you.
Mr. Chairman, if there are no further questions, this concludes the financial report.
Thank you. I'm glad to hear that all counties are current. That's it. We must be doing something right. Okay. Director's report.
Thank you, Mr. Chairman. Most of these are just updates to the board. First of all, we talked last time we met about the risk management, and that's our liability coverage for the health district, and that includes our malpractice coverage. So it could be malpractice, it could be somebody falling in our parking lot. All of these things are part of our liability. As you remember, with House Bill 316, there was some concern that our current risk management insurance is part of the state's liability program. We were concerned with House Bill 316 that we were going to lose that coverage and need to go into the open market to find that coverage. Right now, that's about $57,000 a year. If we went to the open market to get risk management coverage, that would be at least 3 times that. So thankfully, through the effort of district directors around the state, we were able to get that changed. It's in what's called House Bill 515, that we will be able to continue to stay with the state risk management system. Both the House and the Senate have approved that unanimously, and it's currently on the governor's desk for signature. That got to his desk actually yesterday. So we're hoping that he signs off on that, but I'm quite certain that will happen. Board of Health communication. We wanted to talk to you a little bit about the emails that you use to communicate regarding health district business. With the ability of the public to access public records, if they were to access public records about a particular topic, they would also have access to your personal email if that's what you're using associated with communicating with anyone within the health district. So it is my suggestion to each of you to use a PhD email associated with PhD business. That would be the only email a public records request could access. So, Mr. Chairman, I'm just asking for you to consider that. I don't feel a board action is needed for that, but if you would prefer that additional protection, we would be happy to set you up. Daniil will set you up with a PhD email address. So like for now, my email address is dduffy@phd1.idaho.gov. For you, it would be gbailey@phd1.idaho.gov and going forward. So if you wish to do that, let me or Daniil know, and we will set you up using that.
Mr. Chairman, may I add
Yes.
that each Board of Health member currently does have a PhD1 email address.
So we have been assigned one.
Yes, yes,
All we have to do is say, thank you.
yes. And if
Okay.
you haven't activated it yet, please let me know and I will work with IT to get you signed in and activated.
Thank you.
Mr. Chairman, item number C that we added at the beginning of our meeting today, and this has to do with opioid settlement funds. We have talked about that here in the board, at the Board of Health meetings several months ago, that with the opioid settlements that's happened with 3 opioid producers through the Idaho State Attorney General, that through that settlement, that requires funds to various organizations for over the next 18 years. We are one of those organizations. The state, certain cities and certain counties, actually all counties in the state of Idaho, are all eligible to receive funds for the opioid settlement. We have been approached by the city of Hayden and the city of Coeur d'Alene that they have the option to allocate their funds to us. And in a city council meeting with Coeur d'Alene that I sat in on Tuesday, I provided some testimony, and they agreed and voted so to allocate their funds to Panhandle Health District, and that's $73,000. And what I did offer to them, that we will report to them regularly on how we're using their funds. And I also put a call out to Post Falls this morning to see if they would be interested. It just would be much easier for them than hiring employees. And this is true Also with all of the 5 counties, they are also receiving these funds. And of course, we would encourage them to allocate to us to use those. We've been involved in the trenches in opioid use disorder since 2017, as you all know. So, but either way, even if they keep those funds, that's fine. We would support them in that. But just to highlight what's happened with the city of Coeur d'Alene and the city of Hayden. Finally, after speaking with our executive council, our PhD safety team, and also asking feedback of all of our PhD employees, I made the decision to lift our mask requirement here in the health district, with the but it is optional. And in our clinical settings, our clinic office and our home health, where we have direct patient care, providers can certainly wear a mask. They have the option to ask patients to wear a mask. And also, they will don a mask if a patient asks them to do the same. But it's completely, at this point, their choice. We made that decision for a couple of reasons. First, most important, the wonderful feedback that I received from so many. But also, we are following the CDC guidelines and the state guidelines that we will follow, what color we are in. And right now, all of the counties in the state of Idaho, with the exception of Idaho County, and I believe, Benawah County, they're in yellow, and we're all in green according to the CDC. If you're in those guidelines, masks are not suggested in indoor settings. So we are following that, but we're also following our other gating criteria, which includes Kootenai Health, which reported this morning they had no one in critical care. Very, very low numbers are happening there. The positivity rate is 2.5% or less. So we felt very comfortable. I felt very comfortable making that optional. We no longer have signs outside our front door to wear masks. But we do continue to have available mask dispensers for those that are comfortable with that. So I just wanted to update you on that change here in the health district. And that each week, Catherine Hoyer, Jeff Weigel, our epidemiologist, and I will review that. If there is a spike, we may reconsider the optional nature of those masks. But right now, we're very, very comfortable where we are with that. And Mr. Chairman, unless there's some questions or comments, that's the end of my report.
Eric, are you ready for a report that you could hand to me?
Mr. Chairman, yes.
We had 13 votes, but 10 of them were legal votes because the 3 we counted as illegal did not have a signature by the voting commissioner.
Okay.
It would not have changed the outcome.
Okay.
Any other questions?
No. Okay. The way I read this report, this was for the nominee from Bonner County for Dr. Thomas Fletcher. Number of votes cast was 10. Necessary for election, a majority would be 6. And Dr. Fletcher received 6. And 4 votes negative. So as I read this, Dr. Fletcher is elected to the board by receiving a majority of the votes, which is 6, which was the number required. All right. uh, we can take no action. We'll probably have to take action on this at our April board meeting, but at least you have this report. We'll have to decide, is this enough of, help me out here, I need help. Since we have not taken official action, do we still have our director contact Dr. Fletcher and invite him to the April meeting?
Mr. Chairman, I believe we can, but I would ask that you give me permission to speak with Mark Lyons to confirm that based on this tally.
Okay, and this information will be kept.
Yes, sir. And just to remember, this is for a term ending on June 30.
Oh, thank you.
So this is only an interim,
Enter to
That's correct.
he's fulfilling Dr. Banks' term,
completing his term.
completing Dr. Banks' term.
There were 15 votes invited and only 13 responded. Is that correct?
And we had, go ahead,
Okay.
explain, because some ballots were not accepted because they were not signed or dated. Any further comment from you two folks? Thank you for.
Mr. Chairman, I believe that that's an excellent summary of the situation.
County commissioners failed to follow instructions?
No.
Thank you.
Okay, so Donna, between you and you, find a place where these can be kept.
And Mr. Chairman, do I have your approval to speak with Mark Lyons to confirm this?
Absolutely.
Thank you.
And get a ruling on that, since the restrictions under which we have operated today. And if there's no other business to come before this board at this time, thank you.
We have Mr. Kemp.
Did we, oh yes, we omitted you because you were busy. I'm so sorry, Harry. You have the floor. Yes.
Although I would not have objected to including me.
His first big participation under this new position, and
And then the chairman tosses him
just
under the bus.
Thank you, Mr. Chairman. There were two topics that I will be addressing today. One is going to be the status of the Panhandle Health District's Idaho Administrative Code rules. The other will be an update on the progress on the Lawrenceburg building. I'm going to try to keep this as abbreviated as possible in regards to the Idaho Administrative Code rule. It's been a bit of a saga, to be honest with you. But to summarize, the rules of the Panhandle Health District largely address two specific issues. Our role in the Superfund site in Shoshone County, Bunker Hill Superfund site, and protection of the Rathrum Prairie Aquifer, which is predominantly located in Kootenai County, and the rule only applied in Kootenai County. In short, I do not expect, the health district will not have an Idaho Administrative Code rule at the end of the current legislative session, is really the short version. How we got there, with your permission, I'll give a little background. In the legislative session of 2019, the legislature did not pass a concurrent resolution allowing all Idaho Administrative Code rules to continue for another year. We, along with every state agency, found ourselves with rules set to expire June 30th of that year. The governor utilized his authority to temporarily authorize all rules to give agencies an opportunity to, make reductions to the rule and then to go through the negotiated rulemaking process in the hopes of getting those rules authorized the following year. And just as an aside, my understanding is that process is still ongoing with any agencies. In regards specifically to the Panhandle Health District, We, along with the other agencies, worked through that process, through the proper noticing and so forth. Legislative session 2020 came around. We had a hearing in the House Environment, Energy, and Technology Committee. Our rule was approved in that committee. We also had a hearing in the Senate Resource and Environment Committee. Our rule was approved in that committee. However, in order for the health district to promulgate rules, we also have to have a concurrent resolution. That action did not take place. The session ended. We were then again, along with many other agencies, reauthorized through the governor's authority to temporarily reauthorize rules. Again, the process begins again, and as Christine will tell you, there is a cost, not only in staff time to go through this process, but also fees associated with being part of the process. Needless to say, we went through the process. Legislative session 21 came around. We had 2 informal question and answer sessions with the House Committee. However, they never provided us an official hearing. The Senate Committee, however, was much more favorable. They approved the rules. As a matter of fact, they commended the health district and the community for addressing local issues at a local level. And that's a point maybe I'll elaborate on just very briefly, is that these rules are very supported by the communities that they apply to. So this truly has been an issue with working through the Idaho Administrative Code process more so than battling people for the value of what the rules do and the safety that they, or the public health benefits that they bestow to the community. So needless to say, without a hearing in the House Committee, we did not satisfy our statutory requirements, and thereby our rules again were temporarily authorized by the governor's office. And again, emphasizing this again, along with many other rules, with other state agencies. So fast forward to late December of 21, and this is also to a degree, very much to a degree of an impact of House Bill 316. The governor's office informed us that as we were not a state agency, an official state agency, we could no longer participate in the omnibus rulemaking process, which we had been engaged in, and they summarily dismissed us from the process. That left us in a bind, to say the least. Our options were extraordinarily limited. Dawn and I, we met with our legal counsel. We explored what our statutory authority allowed us to do. Frankly, 2 options arose. One was to try to champion our own rule with our own local representatives and get the rule passed. That was deemed to not be a very viable option, simply because even being part of the official process and being on the docket in a manner where there was an expectation of getting a hearing, we couldn't even get a hearing in that setting. So how would we ever get a hearing as this standalone agency? And what makes this more challenging is that we're the only health district in the state that has a rule set. So we're the only one with the dog in the fight. So, even more so difficult. So the other option was we do have the 30-day order authority. While an option, our legal counsel felt that was likely not a best use of that authority, and frankly, even very practical one, because it's such a thing that we push the rules on or carry the rules for 30 days. Not only would we have to bring it in front of this board every 30 days, we would have to bring it in front of the boards of the impacted counties, which would be Shoshone County and Kootenai County, which is frankly not a terribly practical approach. We, at that time, were concurrently engaging with DEQ to see what intervention that they could assist on. They have been very supportive of the process. They very much recognize the value of the rule, but as previously stated, they have their own challenges with their own rules and the temporary status thereof. We've actually had a lot of support. So Kootenai County, and I will say particularly Commissioner Duncan, worked to spearhead an effort where they would address a portion of our aquifer protection rule, specifically what's known as the 5-acre rule from a land use standpoint. And during their business meeting on Tuesday of this week, they did authorize that emergency ordinance that literally mirrors our rule. Don and I met with the county's legal counsel as well as their planning director to help work out some of the kinks, to make sure that it mirrored our rule in such a manner that there would be continuity of the application of that rule going forward, even under the county's authority. The other concurrent action that we're taking that we'll be bringing in front of the board, hopefully in April, if not potentially sooner, is this aspect of we're not subject to the Idaho Administrative Code rules, but we have to conform to that process. So what we have done is we had communications with the director of DEQ, along with the governor's office, and in a matter that conforms with temporary rulemaking process. There are 2 steps that are in play. One is the governor determining that there is it confers a benefit and addresses a public health issue. We did get that concurrence or that agreement from the governor's office that our rules do meet that criteria and thereby should be temporarily authorized. They are still taking the position that they don't know what authority they can provide, but nonetheless, that satisfies that portion of the statute for temporary rulemaking. The other piece of that is publishing the temporary rule in the next issue of the bulletin. Well, we are not, promulgating a Idaho Administrative Code rule, and we are not a state agency, so we don't have access to the bulletin. So we can't publish it in the bulletin. Our legal counsel has advised an alternate method that would meet that criteria would be bringing it to our Board of Health, who hold the rulemaking authority, and they've drafted a resolution that we would like to bring to you that would grant temporary rule authorization for our rule through the next legislative session, during which time we hope to find a permanent home for those rules, either with DEQ or with the county. Because as previously stated, the likelihood at this time of the health district unilaterally moving forward with a rule through the successfully through the legislature is unlikely at best. So that is a summary. Any questions?
Yes.
Mr. Chairman. Eric, thank you for the status update. This whole situation, would we be out of compliance with any federal statutes?
My understanding is we would not.
Okay.
We would not.
Is the state subject to federal statutes because they've created this situation?
I can't directly address that question, and the reason that I can't is because we haven't been able to get a straight answer from.
No determination at this point.
Correct.
Okay.
Correct. And I don't know if I should mention it, but that was just kind of an off-the-cuff suggestion of one of our legal counsels was maybe we need to sue for clarification on where we stand. I mean, sue the state of Idaho on where we stand. And again, it was really in jest, but there's
What's our liability status is my question.
Yeah.
Okay.
So we continue to work through that process.
Okay. Thank you.
Eric, thank you.
You're welcome. And we'll certainly keep you posted as this has been very much a moving target. And we'll keep you posted as things transpire. So I guess the next item that I will be sharing with you is maybe a much more lighthearted issue, which is updates to our Bonner's Ferry office. And Catherine, how does this?
We'll help you.
No. I don't get a pointer. Has it been that long?
Mr. Chairman, if I might add, Eric Kedner oversees our building and maintenance committee here in the health district. So they have a team that meet on a monthly basis to deal with building and maintenance issues, and that's why
Okay,
we will present to you today.
And as Dawn mentioned, I'm lucky enough to now chair the building maintenance committee, which has been a very, very interesting process today, trying to come up to speed. So I'm going to do my best on this presentation. It really has literally been the last couple of weeks that I've been looking into this issue. Pete and I went up and visited went up to review the progress on March 15th. We met with the contractor, and I have a few before and after slides. And I do have to graciously thank Michelle for building this presentation. I was able to just simply update it, which saved me a tremendous amount. So actually, before I get started, one thing I'm sure you guys or the board has been updated periodically, but our staff up there are currently working out of the conference room, and those are fairly tight quarters. The contract on this was signed on January 14th. In mid-February, construction began. The contractor believes that assuming he can get that the carpeting comes on time, that he will have this project completed by the end of May. So what we have is we have pictures of each of the areas that was going to be worked on and major aspects of the construction or the remodel that were going to occur in each of those areas. First item was removal of this rounded countertop, extension of this door down the hallway for two purposes. One, it would create a window, two window access points for clients. The other thing is that it will grab, you can see right here, a bathroom, so it'll allow for public access to a bathroom, whereas previously you had to go through essentially a locked door to get there. So as you can see, much of the work has been done on the windows. The door has been moved to the back. There's still some work clearly left to be done on the window.
So question, Eric, that door we're seeing beyond the two windows, that's a restroom?
Correct, right? Yes.
On the left?
Yeah, there was a male, and then this next door down here was a female restroom. Actually, it will still be a bathroom, but this will be basically a unisex bathroom available for public use for people in the waiting room.
So how do they access the back office area, the public?
The door, they basically took this door and they're moving it to here. The door hasn't been framed in yet.
Okay.
So that, yeah, this door will just move back 12 feet.
Controlled access door.
Yes. Yep. So in the clerical work area, they're going to replace these countertops. That has not yet occurred. Those are on time though to be completed for installation. My understanding too, in talking with Pete this morning, is that the drywall work has all been completed. So these are slightly dated photos, even though they are from a week ago. New lighting has been installed. They've installed the can lighting and replaced these fluorescent fixtures. They've opened up the wall right here. Or there was basically a countertop area here. They've opened that up and also adjusted this wall slightly to allow for more of an open concept design, which I understand was the plan. Similar photo to the last, just takes into account view from the clerical positions. This cabinet is going to be moved to basically to the next wall over. And again, you can see the new countertops are going to lay out through this area for the clerical staff. So, and this is where that cabinet that we looked at is going to sit on this wall. This is going to go away again back to this open concept design. Okay. So this is a a view opposite of the intake area that we were looking at. Here's that bathroom that now will be accessible to the public. This is the door that was moved back. So it's framed here now. It's not a good photo in the respect that you can't see the bathroom door here, but it is just on the other side of this doorway that's framed in. And along those same lines, by moving this door back, it would have, this doorway into this exam room would have been compromised. So they moved this back 3 feet, and that's what you're seeing here.
Okay.
This is the clinic area. This is the back door to the building. And so what you would have is you'd have employees from various programs that would access through this doorway. If there were clients back here in this area, there was very limited privacy. So they framed up a wall through here. A pocket door has been installed in this area so that when we are seeing clients in this back area, people entering and exiting through this way will not be able to peer in on those activities. This is the opposite view of that same clinic area or that same laboratory area. This small bit of wall was removed. The refrigerator is going to be moved back over here where the freezer is. Desk space is going to be placed in here, but they continue to make good progress in that regard. I'm trying to let the photos paint the picture for you because I am not eloquent as a speaker.
You're
So
doing fine. I sure hope you keep that same floor pattern.
it's
Have a checkboard?
there's a theme of that color throughout the building as you can see. But no, that is part of the improvements. Is that floor will be pulled up and replaced with the vinyl plank.
Some of that really dates
Laminated?
itself.
Yes.
Okay. Laminated flooring?
So I appear to have beat pictures of the lab to death. So I'm going to move right past that. This takes us back to our the waiting room lobby area where there was a playroom area right here that had and apparently there were visibility issues where people's children would go in there and not be visible. So and I can tell you what they were doing, and I'll tell you how I know that because I worked in the Bonners Ferry office for about 2.5 years. And the environmental health office is on the other side of that wall. So what they were doing is they were pounding against that wall with their toys in their hands. So, but needless to say, that was apparently problematic. So this has now been, you can see that's been opened up. Other aspect of this construction was moving this fire extinguisher and AED to this wall, which you can see has been completed.
Yeah.
And again, all new flooring will be occurring in these areas as well. And I do have an image at the end that shows where the different carpeting and vinyl flooring will be located. So some additional progress that's been made. As you know, the structure of that building, it has the lab in the center and then it has the clinical rooms and the offices kind of on the perimeter. The painter has been able to get into the majority of those perimeter offices and clinic rooms and complete the painting. So the painting is done for the most part, and the painter was just waiting for the drywall to be finished so that he could paint. But otherwise, everything is moving along in a very timely manner. The other thing that I have to say is, having met the contractor up there, is that there are some minor things. Two things. One is we did get the first draw request, and he's right on track as far as his what he's requesting and what he's projecting his costs to be. The other thing is, as he's working through the building, he's finding these small things, like he was finding along the windows that these knobs were wobbling or falling off. He's been touching them up and tightening things up as he goes along. So he really does seem to have an attention to detail.
So those windows crank open
That's-
for ventilation?
That's correct.
Okay.
So other pending items, the real outlier here is the flooring, and that is tied to what we're seeing across the board in the building industry is access to materials. Update that I received this morning from the contractor is that the vinyl tile, my terminology probably not quite correct, is scheduled to arrive on April 4th. The carpet, they still have not received a confirmed time for when that will be available, but because the rest of the work is on schedule to be complete, carpet one is scheduled to be into the building, removing the carpeting and so forth in preparation for the new carpet. Other items that are on the list of things to do: replacement of the window blinds in both the office area and the adjacent conference room, new hardware on all of the cabinetry, baby changing stations in the restrooms, replacement of the hanging light in the lobby and waiting area, new lighting in the conference room, and new countertops in the conference room as well. And one of the items, just as an aside, the contractor said that a lot of the products that are showing up are of poor quality to where he has had to send. I think he sent the baby changing stations back 2 or 3 times because they've come damaged, or they'd be, one that the pocket door was the same type of thing. So he is keeping an eye on the products that he's installing in the building. And I do feel like keeping an eye on our interests in this remodel. And this is the image I was referring to, where the new carpeting, they're going to have essentially high impact weather carpet tiles on the entryway that will have a prolonged use. The yellow, I believe, but can't see, is going to be that vinyl plank tile, or that vinyl plank. And then carpet will be in the green shaded areas. That's all I got.
As happy as the folks were at Sand Point when they finally got a new building, I'm anticipating these dear people up at Bonners Ferry are going to be equally happy to get into a new facility, even though it's remodeled, it's new to them, over something that was really fine when it was first built, but it became so outdated.
And Mr. Chairman, to that, I think that they're going to be happier because they've all been crowded into that little conference area where they're trying to conduct business and continuing on with our programs. They're still doing WIC, they're still seeing clients, all out of this tiny, very compressed area. So I think they'll be thrilled when they move into the new.
The only other comment, and this is just my own personal, I see up there, you keep talking about these baby changing stations, and I have observed over and over again, the moms and dads always come out with the same baby.
They haven't changed?
No,
Any questions? Thank you.
thank you, Eric. I don't want to overdo this, but it sure pleases me to see you performing in your new position.
Thank you.
All right. Is that it? Any other business to come before this board at this time? If not, Glenn, all's left you and me. I guess we'll send the rest of them home.
Let's adjourn.
Okay. Thank you, everyone. I can't remember when we had a meeting without a quorum.